Hello YouTubers, welcome back to my channel. It's Dr. Rosie, your friendly family physician, and today I'm going to be talking about some of the most common and annoying symptoms of pregnancy from the standpoint of a woman who's already been pregnant and is currently pregnant, and from a physician standpoint with some medical knowledge behind what I'm teaching you about. If you're curious about this, if you've ever been in a situation where you're suffering from symptoms of pregnancy, whether they're debilitating or not, and you want some help, this is the right video for you. Before we get into it, please subscribe to my channel if it's something that you enjoy, meaning learning, educating, sharing, growing. This is the channel for you. Please subscribe and share it with someone who you think can enjoy it as well. Now, to give you a little bit of background, first and foremost, any of the issues that seem severe or come up during your pregnancy should be discussed with your OBGYN. So the person who's following you for your pregnancy, or whoever's following you, whether it's a family doc, whether it's whoever, should be discussed with them first. Now, these still are some of the most common things that happen, and I've learned how to manage them very well over the years, and that's why I want to share with you guys. To give you a little background, in terms of pregnancy and physiology of pregnancy, you may or may not know, but the body undergoes incredible changes in virtually every system of the body during pregnancy. It is a 9 to 10 month process, sometimes shorter, sometimes longer. And there are changes in every system, be it neurological, musculoskeletal, dermatological, cardiovascular. Every system is changing and adapting for the growing fetus in the mother's body. That being said, with these adaptations come symptoms and signs that could be very bothersome for the woman who is, in fact, pregnant. So let's get right into it. First and foremost, I'm going to talk about the dermatological system, so skin issues, cardiovascular, all right, so mostly to do with blood pressure and feeling dizzy, musculoskeletal, some of those common aches and pains and what you could do about them, and then gastrointestinal, so that reflux, that constipation, the hemorrhoids, the things that people don't often talk to you about and sometimes are even disregarded in your doctor's appointment. As you know, there are multiple throughout your pregnancy, but they're often short and really to the point and only dealing with the most important stuff, but these things are often ignored or not really dealt with. So I'm here to get a little bit deeper into them with you today. Number one, let's go right into it. I think one of the most commonly discussed are the dermatological changes. We're going to talk about two, one being stretch marks and two being acne. All right, so stretch marks, let's start with that. Stretch marks are not going to happen in every woman, but tend to happen very commonly in pregnancy. Where do they appear? They appear often on the breasts, on the abdomen, on the buttocks, and on the thighs. Most common, okay? Now, it's not to say that it happens in every woman, but a big chunk. I think somewhere around 60% or 50 to 90%, depending on the studies I was reading. And I'm going to tell you that I did a lot of research into all the evidence around striae gravidarum, which is a fancy word or a Latin word for stretch marks during pregnancy. And there isn't that much evidence out there. But whatever is out there, I'm going to share with you, and also my personal experience, things I've used in terms of creams, I'm going to share my personal experience with stretch marks during pregnancy, I'll be sharing with you. Number one, what are they? Stretch marks are rapid stretching of the skin, which are usually purplish or reddish appearance, and then after pregnancy tend to become hypopigmented, so very pale lines on these areas that develop stretch marks. What could we do about them? First off, let's just mention that some people are going to be more at risk of developing them. Who's more at risk? Simply put, someone who's already had stretch marks in previous pregnancies, someone who has a family, so genetic predisposition to it. If all your sisters and your mother develop stretch marks, you have a higher risk of developing them during your pregnancy. And someone who's also overweight before their pregnancy or who gains weight rapidly during their pregnancy. Now I'm going to segue quickly just to say that for a healthy woman of normal BMI pre-pregnancy, BMI is your body mass index, that this doesn't apply to people who are underweight, who are overweight or obese pre-pregnancy, but for a healthy woman pre-pregnancy, a normal weight gain, or healthy, that's recommended, is between 25 and 35 pounds, all right, by the end of the 40 weeks of pregnancy. And it's not to say that you won't get stretch marks if you gain that much weight, but you're less likely, where someone who gains weight more quickly during the pregnancy is also at risk of developing stretch marks, okay? Stretch marks usually appear after the 24th, 25th week also of pregnancy, so keep that in mind. You're not going to see them early on for the most part. You're going to usually see them later down the line. Now, what does the evidence show? What creams work, what creams don't work? There is such little research on this, so I'm going to also talk to you about what worked for me. The 4 ingredients that were in one of the studies that I read, active ingredients, which a cream that actually had all of them. So the 4 ingredients that caused less severity of the actual striae or stretch marks, prevented new ones, and halted the progression of ones that already existed were these 4 ingredients. Vitamin E. The other one is rosehip oil. The other one is Centella asiatica and hydroxyprolicylene C. I'll write them down so you guys can research them on your own. Those are the 4 active ingredients that did show evidence. Now, things in research that showed no evidence, again, may work for you, but showed none, was cocoa butter and olive oil. So any studies that involved those showed no effect on preventing or reducing the appearance of stretch marks down the line. Now, these 4, though, did show some evidence, like I mentioned. Where do we find these? How do we know? I'll tell you from my experience, the one cream that I used during my first pregnancy, which after looking at the ingredients this pregnancy around, I actually noticed included one of the active ingredients, is this super inexpensive cocoa butter base, because Palmer's, I think all their products are cocoa formula based, but that includes the Centella asiatica product, and which sells for less than $70 at our local Walmart, which if you're in the States is probably like the equivalent of $5. Really cheap and effective in my case, meaning I didn't develop any stretch marks and I didn't have any permanent ones afterwards. Use it religiously. 1 bottle was good enough for my pregnancy. You might need 2, might need 3, I don't know. But this was the effective cream for me. Now, what else am I using this time around? And it's actually marketed as anti-wrinkle, is a type of body oil that I apply also after a shower or bath, and it's by Uriage. So if you want to look a bit more into it, the ingredients do not involve any of those active ingredients, in fact, but as a body oil that has minimal ingredients and mostly natural plant-based ingredients, quite effective. For now, we'll talk by the end of my pregnancy if it's still effective. That's it for stretch marks. I won't get any deeper with that. Now, in terms of acne. Acne is the kind of thing that is not going to happen in everyone who's pregnant. About 50% of women get worse acne, and 50% of women will actually have their acne clear up during pregnancy. So it's really unpredictable. But for those who do develop acne, here's what to use and here's what not to use. First of all, do not touch retinoids. Anything with retinol, retinoid base, which is a derivative of vitamin A, could be potentially teratogenic, which is dangerous for the growing fetus. We avoid that. Hydroquinone, which is more in the realm of pigmentation, less for acne treatment, anyway, should not be touched. And your doctor will be able to guide you through this as well, the one treating and following you through your pregnancy. Otherwise, oral antibiotics, which we commonly give in non-pregnant women for pretty moderate to severe acne, are not tolerated. So tetracycline, doxycycline, all these things we don't touch. What can you use instead? First off, those are the things we don't use. What can we use? We start with cleansers. What do you use to wash your face? What I suggest is a salicylic acid based cleanser, which is a derivative, well, salicylic acid, but it needs to be less than 2%. So the important thing to look out for is the percentage concentration because of risk of absorption. When it goes higher, there's more more risk. We don't know so much about it. We even know very little about this, to be honest with you. But what's been used very commonly and not shown any evidence of detrimental effects is less than 2% salicylic acid based cleansers. The next are active ingredients, and also this is a cream based salicylic acid, and I believe it's 0.5% by La Roche-Posay as well. Next is an active ingredient, which you would leave on, for example, at night and then wash it off in the morning, and it's called Benzagel. It's benzoyl peroxide, and it needs to be less than 5% active ingredient. So you don't go to the 10%. You could use 2.5%. It also comes in that format, and it comes in a cleanser and or as a treatment. You leave it on, like I said, and you wash it off. Another pregnancy-safe topical is azelaic acid. Virtually any percentage is acceptable, but it's also usually in cream format and well tolerated for people with mild to moderate acne. And that's about all we need to know for acne treatment. Now I'm going to get into the gastric system. So the GI system tends to slow down during pregnancy, meaning people tend to have more constipation and hemorrhoids for 2 reasons. One, there's a hormonal cause. So progesterone is elevated. Progesterone is a smooth muscle relaxant, meaning there's less peristalsis, so less movement of your intestine to actually empty your gastric tract. And 2, and I'm explaining both why the constipation and reflux as well. So reflux, constipation, hemorrhoids is what we're covering in terms of gastrointestinal system, sorry. For reflux, the sphincter, so what prevents food from coming back up in your esophagus, is actually relaxed because it's made of smooth muscle, and progesterone is causing that to happen. Because it relaxes, more food comes up and you get that acid reflux, pyrosis, whatever you want to, heartburn, the really uncomfortable sensation you feel after a meal, after a big meal. It depends. For many women, it varies. Some women won't suffer from this at all, and awesome. But if you do, this is what can help you. And then the same thing for the gastric emptying because of the progesterone. Now, the other element is the fact that you have a growing fetus and a uterus that's growing 10 times its size in your abdomen. And all that pressure is pushing your stomach upwards and causing some of the reflux, all right? Now, what can you use? Number one, change your lifestyle if you can. Meaning, for sure, pre-pregnancy, you should have stopped tobacco and alcohol. So that's one, and those are clear triggers. Two, things like caffeine, acidic food, tomatoes, big fatty meals. These are things that are gonna trigger acid reflux. Eating 2 hours before sleeping, another thing, especially if you suffer from it before sleeping. That's the lifestyle stuff. Then in terms of medication over the counter, you start with calcium carbonate, my best friend, Mr. Tums. Now choose a flavor that you actually enjoy, because chances are you're gonna need a lot of it if you really have bad acid reflux. I'm into the strawberry or berries, assorted berries. I've got a citrus one, I hate it. So berries is my jam. But Tums, keep them in your back pocket, keep them in your purse. They have mini packs, just keep them everywhere. You'll need it. You'll be frustrated when you don't have it. The other thing would be magnesium hydroxide, so like Malox, also over the counter. Calcium carbonate, magnesium hydroxide, all okay to be used. Then the next thing, if those don't work, so these are simple antacids, are things like Zantac or ranitidine. You can also ask your pharmacist and they'll probably direct you, or your doctor. Now, if none of these are working, definitely ask your doctor. There are some that are given under prescription, but again, in very specific situations and more severe symptoms. But these are the things you can start with that seem to be very effective. Next up are constipation and hemorrhoids. So most important thing for constipation, increase your hydration. Many of us are not drinking enough, at least 2 liters, probably more when you're pregnant, a day. So hydrate, hydrate, hydrate. Increase your fiber content. So if you're not having it naturally through berries, fruits, veggies most of the time, oats, basically high fiber food, whole wheat food, you can look at the nutrition contents, then you can supplement with things like Metamucil. So you should be getting 25 to 35 grams a day of this fiber with all that water, because if you just have fiber and not enough water, you'll actually constipate. So you need both of them to help a normal, better gastric emptying and flow. Yeah, so these are the things you do for constipation. Now in terms of hemorrhoids, a sitz bath, elevating your feet when you're actually having a bowel movement is really helpful. So having a stool, they call them squatty potty, in fact helps because our anatomy is not made to be sitting with feet downwards, but in fact elevated for optimal emptying. And there are other things. So for hemorrhoids, there are products you can find over the counter like Tux pads, anything with zinc oxide based like Anusol. This is acceptable. You can use topical corticosteroids at a low concentration, will reduce some of the swelling. And you can also use topical anesthetics like lidocaine, xylocaine to freeze kind of anesthesia the region where you're having hemorrhoids. If these don't work, obviously, like I always say, speak to your doctor. If they're severe, if they're bleeding, if they're extremely symptomatic, there are surgical options, but they don't always tend to get this severe during pregnancy. But consider these things first before going into that. What not to touch is preparation H, because it in fact has sharp oil, which could be dangerous for you and for the fetus. Also, do not touch castor oil, which can cause meconial aspiration in the baby. Don't touch any of these, castor oil, sharp oil, or anything containing those, including preparation H. The next topic I'm going to talk to you about is dizziness. So dizziness or hypotension are very, very common in pregnancy. It's the effect on the cardiovascular system, some of the physiological changes, dilation. I won't get too scientific about it, but you're going to get low blood pressure. Typically, if your blood pressure is high, completely abnormal, you need to be seen for this. You might have hypertension in pregnancy, you might have preeclampsia, whole other ballgame. But I'm talking about low blood pressure, which is typical in pregnancy. One of the most common symptoms is dizziness. So you may get out of a seat or get out of your bed and feel like, whoa, everything's spinning around me. Here's my advice to you. Number one, hydrate, hydrate, hydrate. The more flow you have, the more liquids, the less likely you are to be so hypertensive, so dizzy. Number two, wear compression socks. I'm not right now, but compression socks will be bought from the pharmacy over the counter. They go up your calf and they really help reduce, bring up at least minimally some of that pressure, especially in orthostatic hypotension. Now, I mentioned getting up slowly. Now, it's very specific the way I describe getting up. Friends, here I am live from my bed. I'm going to demonstrate how to ideally get out So I'm not in my last trimester yet. Being on my back is okay. I still lay on my left lateral side. However, when you're dizzy and getting out of bed, this is what I mean. You first roll yourself over. If you feel slightly dizzy, wait 30 seconds. Then you'll push yourself to a seated position. Again, stay here, wait 30 seconds. If you've got a glass of water that you can sip on while you're there, amazing. Wait 30 seconds before then standing up fully. All right, that should be the progression of things. Lastly, a lot of people experience this dizziness and feeling kind of nauseous of low blood pressure when they're laying on their back. Typically in the last trimester, because the growing placenta and uterus and fetus is so large and heavy, it's compressing on a big vessel, which is called the inferior vena cava, right? Which is in the abdomen, which is, when compressed, going to cause more hypotension because there's less blood flow to the heart, which causes less cardiac output and blood flow to the rest of the body, hence low blood pressure. What do you do in that case? The optimal position is basically a left lateral side sleeping position while you're pregnant, while you're sleeping or laying in a bed. And when I talk about left lateral decubitus position, it truly means laying on your left side as you sleep. And if you want a bit of more comfort, put a pillow between your legs. That's the move. Okay, friends, so now we're at the musculoskeletal portion of this video, which is going to talk about the common low back pain and sciatic pain that women tend to have while pregnant, and a few stretches and releases that we could do to alleviate that discomfort. Again, if this is not enough or these feel painful or uncomfortable, always seek medical advice with a physical therapist. Ideally, they're the experts at this. But here are some of the common things to help release. So remember, during pregnancy, there is a growing fetus inside and the pelvic cavity is stretching. It's obviously accommodating for that extra weight, for that extra space being filled, and that's all normal. As you can see, I'm very much pregnant. But sometimes that tension will end up weighing into the backside, which could also impinge the sciatic nerve, which may radiate down to the buttock and even up to the feet. Very common. So here are some stretches. So side lying, kind of in a lunge position. What we don't want is this, right? People tend to do that. I'm opening my hips. It's not very effective. More effective, and I'll show you landmarks, is if you're holding your hips here like so, you want to tilt your pelvis frontward like this. Okay? You want to contract your glutes. And then you want to slowly bend into that hip. And you're going to feel the tension. You're going to feel the release of this hip. All right, so you can hold it for 10 seconds. You can slowly hinge until you rotate with the other side. Same, 90 degrees. Hold the hips, tilt the pelvis, contract the glutes, and slowly hinge into it. Take deep breath to help you get deeper into that stretch, but that's a hip opener. Thoracic spine rotation. So if I'm going on all fours, starting here in like a bear hug position, you could use a foam roller if you have one. You don't need it. Foam roller would be under this arm. You are going to reach, right, for the other side and let your shoulder touch the ground. When you get here, take 3 deep breaths and come back into neutral before going to the other side. Same. Reach over, you're going to see my shoulder touch the ground. Take 3 deep breaths and come back into neutral, right, on your side, and you're going to release your glutes on your own. So this is actively mobilizing the sciatic nerve. So you're going to lay on your side, again for both sides. Put your thumb into your upper glutes, which is up here, just under your hip. And you're going to, with the activating leg, the one above, rotate the hip in and out. In and out, as you compress the nerve at the top. So you're actively releasing your sciatic nerve while you do this. So the knee's going down and it's going up. And you're going to do the same thing on the other side. The next stretch or release is also specific to the sciatic nerve. So you're going to lay on your back, and this is called a nerve floss. Nerve flossing is effective because it kind of gets the movement of the nerve within its path. So you're going to lay on your back, try to have your lower back stuck to the ground as much as possible. We'll start with the right leg. You bring and of course within comfort. If it's not comfortable, don't go as far as I'm going. So ideally you want to get at 90 degrees, flexion of the hip. Then your knee's going to fully extend and you're going to dorsiflex your foot. You're going to bring it back and forth. And you're going to ideally do this at least 10 repetitions. per side. So don't worry too much about the other leg. It's not really relevant here. What's relevant is what's happening in this. And you should feel a nice stretch at the end of that. And this also applies to people who are not pregnant, who suffer from sciatic pain. It can be very effective for them. Lastly, we're going to do a kick twist, which is going to help release the lower back as well. So you're going from here, one leg at a time. You're going to twist over and bring it back. Twist. Oh, and try not to rotate your whole spine. That's not the goal. It's really just to focus on the lower back. So do what is comfortable. Bring it back and forth. Kind of like a windshield wiper. And you can do the same with the other foot or leg. And that's it. Hope you guys enjoyed those stretches and that mobility work. Again, to help alleviate some of the pressure and pain in the lower back, in the sciatic nerve, which is so commonly affected during pregnancy, especially in the last 2 trimesters when the weight gain is much more significant and impactful on the actual pelvic cavity. I hope you enjoyed this video. I hope you learned something. I hope you're able to apply what you learn if you are pregnant or planning to conceive down the line and will eventually experience most likely at least one of these very exciting symptoms. And if you did learn something and feel like you're benefiting from it, please subscribe to my video and share it with someone who you think can also enjoy these tips and tricks. Have a great day.